Hey, I'm Michael P. Coleman, Content Director for Brother Be Well, and welcome you to the platform today. Today, we're going to be talking about the coronavirus. Everybody's talking about it, but we're going to specifically focus in on the impacts that the virus has on men. We're joined by one of my new best friends, Carter. Todd is a registered nurse, and he's the president of the Capital City Black Nurses Association. What's up, Carter? How you doing tonight?
What's going on, Mike? Good to see you as always.
Great to see you, man. And I've got a new friend by way of Carter, Todd, Jerry Bambao. He's also a nurse, and he's at home recuperating from COVID-19 right now. Gentlemen, welcome to the program. Welcome to Brother Be Well.
Thank you for having us.
Before we even get started with this conversation, Jerry, you're the second person now that I've directly spoken to who has this virus. There are all these myths going around about who can catch it, who can't. We'll get to that in a minute. But I just want to check in with you. How are you feeling? I want to hear a little bit about how you contracted the virus and what the path to recovery looks like for you. When can you look forward to a full recovery from this thing?
You know, right now I feel just tired. I got the virus confirmed a little after Christmas, and just feeling tired. I mean, I've social distancing from my family, so I mean, I can assume that I got it from work. But you know, I do have spent some time with my mom watching my kids and little interactions with them. But it's probably more work related. I feel as though energy wise, they say it could take about a month to get back to normal with this fatigue. Luckily, that's probably one of my only symptoms that's lingering on. I can breathe. That's what I tell everybody. I can breathe. That's the one thing I hold on to. I can breathe. I am tired, but I can breathe.
Wow. Well, I'm glad you're breathing. Keep breathing, brother. And if I can do anything to help as you recover, just let me know. As we all know, all three of us know, there's a variety of factors that are associated with this thing: biological, psychological, behavioral, social factors, which put men at disproportionate risk to death from COVID-19. Studies have shown that while men are no more likely to contract the virus than women, we're 3 times as likely to develop COVID-19. Which blew my mind when I read that. And we're also dying at rates that are far higher than women. And Jerry, I realize I maybe should have held those statistics as I'm talking to you. You're going to be one of the ones that makes it, but a lot of brothers don't make it out of that. Carter, I'm wondering about, are you seeing that at the hospital you work at? Are you seeing more men suffering more seriously to this virus? Jerry, same question to the two of you. What are you seeing with your patient populations with regard to this?
Fortunate for me, I'm in the pediatric ICU, so I don't see a extremely large amount of the COVID-19 population. When I think about folks out in the community, though, like you, Mike, the people that I actually do know who have COVID, when you asked that question, I started kind of thinking in the back of my head, I'm like, you know what? It is mostly men that I know.
Yeah.
I think it's maybe one woman that I know from a personal standpoint, and everyone else is a man. So that does line up.
Wow. What about you, Jerry? What are you seeing there?
For me, it's a little mixture of both. We're not one of the COVID units, but we'll see patients that come up positive, and I would probably say it might even be actually the opposite. I actually probably seen a little bit more of the, maybe slightly on the females that might.
Wow.
So, that's from my experience, but I'm not even keeping track of it. I mean, it could be, and I'm not even there every day, so it could be that it really is more than men.
I bet. I wish that we had an earlier conversation also on the Brother Be Well platform about the mental health impact of COVID for first-line responders. So I feel like thanking the two of you for the work that you do every day. It's hard work. I'm wondering, back to this gender question. Women, for generations, they've been referred to as the weaker sex. From what I'm reading, that may not be the case, and that Y chromosome that we've got might not be doing us a whole lot of good with regard to inoculating us from disease. Can you talk about that a little bit?
Oh yeah, I want to speak on that. I will say definitely not the weaker sex. As soon after I got confirmed, my wife started having symptoms of it, and even though she was not confirmed, she held down the fort while I was in isolation. She was still, being masked up, taking care of me, taking care of the kids, taking care of herself, being vigilant on making sure that I'm taking care of myself in the room. so I was like, weaker sex? No. I mean,
Wow.
in fact, I don't know where I would be without her by my side with this, And then
Wow.
kind of
Wow.
find out a week later, she comes out confirmed as well. So to me, I'm like, I'm here struggling, pounding my head because it was hurting too much. And she's over here just like, what do you need? Do you need water? Do you need tea? Do you need this? And putting herself, putting me in front of her. So, like I said,
Wow.
that's my rock.
Wow. Carter, what about your rock? You seen the same thing?
I seen my wife give birth, so there's nothing stronger on this planet than that. But when you get down to like the biological standpoint, the XY chromosome, women have two X's. We only have one, and there's a lot of good things, good components in the X chromosome, right? There's a
Okay.
lot of like high density of immune genes, so the immune genes will help people fight off diseases and stay well. So women are born actually with more of a fight against the COVID-19, and that's an interesting aspect. So I don't know if that plays into these statistics at all. So no, I think men we're faring the fight that we got born with, unfortunately.
Wow. Wow.